Oh, here we go. We are live
Uh,
for the Crooked Spine Show with Dr. Vrzal. Vrzal, correct?
yes, or Dr.
Perfect,
V.
perfect. Good, good. We're both Southern California docs. One, he's Lundgren Gal, I'm in Upland. And we want to talk about how to help your headaches today. Dr. Vrzal has been driven by constant debilitating headaches as a youth and was cured by a chiropractor. Then he became a chiropractor to pay it forward. That's what I'm looking for too. After about 30
Right.
years of treating patients and finding the root cause of headaches, Dr. Vrzal has now shared his knowledge how to decode headaches and help people fix their pains. There's a book. There it is. And then patients learn how to keep their headaches, keep themselves healthy. Let's learn how to fix headaches through his book, through his knowledge right now on the show. Let's pick his brain. So, first of all, Doc, your professional background, how have you stayed passionate as a chiropractor for all these 5 years in practice, right? About 5 years now? Myself, about
Yeah,
22 for me. So,
yeah. Over 30, but yeah, it's
uh-huh.
seeing the victories, right? Seeing lives
Mhm.
changed, and
Mhm.
people talk about the patients stress about are you going to retire, and that sort of stuff. But how could
Yeah.
they retire from something you love and changing
Yeah.
lives and seeing lives change in such a profound way every day, and it's getting worse. The rest, the other professions,
Uh-huh.
so-called healthcare professions are kind of a debauchery, and it seems to be getting worse. So people are just they need help so desperately.
It's almost like they're not only do they need help, they've tried the medical route. It's not working. They're getting worse,
Right,
and it takes them weeks to get into to their doctor for the next pill, for the next
right.
therapy, the next treatment. So it's almost like they're just done with that system, at least from my viewpoint.
100%. I mean, one of my last patients this today was a gal with cancer. Unfortunately, she'd been down that road and told that it's never going to go away, and she needs to take drug X for the rest of her life, and so on. And she felt like doo doo and all that. And it was a very simple fix. There was some, in her case, aluminum was a toxin from
Wow.
from a couple of shots that she'd had, and some other things that she was doing, and it looked like it's going to be a fairly easy fix, and it was reminding me of my grandfather had a similar lymphoma, and they were told he was told, you got 6 months, get your affairs in order. There's no chemo, no radiation at the time that they could do for him. I went home to visit for the holidays and treated him one time, in the evening. He woke up the next morning, puked violently, and that was it. That was I saw him 6 months later. He's like, I knew when I puked that morning, that was the end of my cancer, and lived another 15 years, lived to be 94 and healthy, and never had another symptom. So, I mean, with that
Doc,
kind
you're almost
of
saving. You're not almost. You are saving lives, changing people's
Mhm.
mortality rate to another level. How do you how do you build confidence in doing that as a chiropractor, as just a healthcare practitioner? How do you do that?
Yeah, so I use applied kinesiology, muscle organ correlations, so
Mhm.
that the body tells a story. Every muscle has an associated gland or organ. So I really pride my in anatomy in undergrad. They stick a scalpel into a muscle and through a nerve and stuff, and say, what muscle, what nerve does this pierce? I kind of took that as, I want to be able, wherever somebody points on the body, I want to know that's a gallbladder problem, or that's a liver problem, or that's a lung issue. So tying in acupuncture principles and nutrition and all of that gives me the venue to really figure out where the body's dysfunctional and what needs to be done to help them get to the next level ultimately and live a
Is,
healthier,
is
happier
that
life.
is that explaining the I guess in detail decoding the headaches, the seven specific patterns too? Is that part of it?
Yes, ultimately, that's how I was able to identify the causes of the seven patterns. Ultimately, again, I got into healthcare because of the headaches I had as a kid, 19 years old. Health.
Mm.
I was a natural bodybuilder and working out, and every time I do bench press, I get these gnarly headaches, and it's like, forget it, I'm going to push through it, and the harder I push through it, the longer they'd last. And they said, oh, you might have an aneurysm. Don't work out. And did
Yeah, scare
the
you. Yeah,
diet.
the fear.
Right. And they said, well, you don't have an aneurysm. Go see a psychiatrist. So, made it my life's mission to figure it out, right, and help others. And so, 30 years later, I have a book about it,
And then
or
part of
more
that
than
too, what are the
that.
triggers that you explain, I guess more in the book too, about
Right.
decoding headaches? What are triggers actually?
So there's 7 patterns, and each pattern relates to a different gland or organ. So I mean, the most common is a right-sided headache. Right-sided headaches are always a gallbladder-related problem, and so that's my first call to action really for docs out there is ask where it hurts. I mean, that's really how I came up with all this. Is every time a patient come in with a headache, all right, where in your head does it hurt? And ultimately, I end up putting that together with acupuncture and nutrition and these applied kinesiology protocols to figure out what the trigger was, and that's how I identified the 7 different patterns. So we've got right sided is a gallbladder, left side is a low stomach acid or stomach problem.
Okay.
Frontal is more of an ulcer type of a stomach problem, frontal headache. So that's
Okay.
more if it's all the way across the front. That's typically the the overstressed kind of person that's not managing their stress properly. So that's a very common one in SoCal, right?
Yeah.
So we got the frontal, and then what I call the third eye is kind of right between the eyes. That's a pituitary issue. That was part of what actually started some of this. Is in chiro school, they said when the pituitary swells, it refers pain to that area,
Huh.
and so that kind of got me thinking in that direction. So we got the pituitary, frontal, and then bitemporal. Ladies, that's your hormonal monthly headache thing. That's going to be on both sides. Typically that has to do with estrogen metabolism, and so we want to correct estrogen metabolism. So we got bitemporals, and then the headaches I had was like a headband or a whole head headache. That's a colon concern. When the colon's not functioning, the whole head will potentially throb. And then the one last headache is the tension headache, what's commonly called a tension headache in the back of the head. That's a thyroid, typically hypothyroid problem, and where the thyroid is not activating digestive enzymes, and so that'll set up the tension in the back of the head. So I mean, we see auto accidents and that sort of stuff. They come in odd, it's my plight. It's been ever since I got rear-ended and so on. Then we need to potentially look at the emotional trigger. As chiros that are listening to this, the simple thing is, go back through the memories of hearing the tires screech behind them, or seeing the
PTSD.
the PTSD. So visualize the grill coming at the back of your car while they get adjusted, and that's going to help take care of the emotional component as well as the structural component, so that then those adjustments are going to last longer. They're not going to feel great when they leave the office and then see another Peterbilt truck that reminds them of the one that hit them, and boom, they go back out. So we can kind of double up, if you will, on therapy and help it last.
It's almost making the therapy, like you said, make it last to where you leave the office. Now there's less risk of having another headache because now you know what can be the trigger. Also, you're almost teaching the patient, okay, where it's coming from. You're helping them understand the cause and the effect of how your treatment works.
Right, and that's the whole. My goal is to empower people, right? Give them the tools to figure out, hey, it's a gallbladder issue, okay, and I lay that out in the book. Hey, these are the most common triggers for gallbladder. For example, I mean, super common one is glyphosate, the pesticide in Roundup, that inhibits bile production, and so that'll set up it's a very common cause of right-sided headaches, and Roundup typically is used to kill the crops right before harvesting of wheat, corn, soy, or oats. So if they're eating those that are not organic, then they're going to be a lot more prone to have that right-sided headache.
It's almost like you're helping people understand.
Sorry.
It's okay. I know you've had a long day, like you're working all day. I think a lot of it is when we talk about helping our patients, it's not only helping them, here's your adjustment, here's your supplement, here's what we're going to do. It's almost like this is what's going on. This is why you're having the problem. Now let's change your diet, your lifestyle, your sometimes environment to make sure it doesn't happen again.
Trying to empower them to be able to solve it themselves, right? Ultimately,
and walk me through what would be a diet change for one, say, with a gallbladder issue or a colon issue. Walk me through how you would talk to patient for each condition, I guess.
Right. So we were on the right side headache, the gallbladder concern. Tomatoes is another typical surprise food.
I love tomatoes, though. What do I do?
Right. Go pesto instead, right? And find a natural and something that tastes well. That's an alternative that's not going to muck up the gallbladder. O blood types will do okay on tomatoes, but the A's, B's, and ABs don't do as well on tomatoes, unfortunately.
Almost like blood type related too, then, correct?
Yeah, so that has to do with how the immune system, what the immune system recognizes as self.
Okay.
So yeah, that becomes relevant as well. So tomatoes, we talked about the pesticides. Ultimately, it's empowering the patient. Like, hey, you've had right-sided headaches. It's a gallbladder concern. You start paying attention. If they don't have somebody like us to help them figure it out, maybe it's journal. Every time they eat pizza, then they end up with a right-side headache or something along those lines. So those are the typical triggers for the right-sided headache. Left-sided headache we talked about is a low stomach acid. So that more typically is we want to look at the emotional triggers, or potentially there's specific emotions with the stomach. Those are like oversympathetic, low self-esteem, disgust. So we want to look at whether those emotions are compromising it.
Okay.
I'm just noticing that.
No, you're good. You're coming through fine on my end, so you're good to go.
Okay.
Good.
So typically there's emotions that could affect the stomach, nutrients that help the stomach make stomach acid or vitamin B1, calcium, or zinc. So if they're deficient in one of those nutrients, then that's a very common cause or reason for low stomach acid. Zinc obviously has gotten a lot of press, since the whole COVID thing, because zinc gets burned up in the presence of a virus. It's part of how the immune system uses up a lot of zinc to fight many viruses, and then we end up losing sense of smell or taste. And so those are symptoms of low zinc. So, and then chronic zinc deficiency is going to show up as little white clouds in the fingernails. So if you're listening, check your fingernails, unless you have nails, nail polish on or whatever. But look for those white clouds. That takes 8 weeks to grow from cuticle to tip. And so that'll tell potentially how long ago the person was zinc deficient, or exaggeratedly zinc deficient. So taking a good zinc supplement is a really common trigger to help foods taste better. So then when zinc levels are back up, then people tend to make better choices as well, because when zinc's low, then food doesn't taste as well, so they need more sugars and things like that, and they tend to crave foods that are not as good for them. So zinc's a big thing. Sugar leaches zinc, stress leaches zinc. I mean, it's massive. Zinc helps make hormones. I mean, it's a huge deal. So that's a very common one.
Do you do like a vitamin, like a blood test with your patients too?
I figure it all out through muscle testing.
Perfect.
Yeah.
Perfect.
I mean, I want them to leave with the answers.
Good.
Ultimately, right?
Awesome. That's awesome.
Yeah. And the beauty
explain for my patients that don't know how that works. How does muscle testing work with, say, vitamin deficiency?
Right. So, as I mentioned, every muscle has associated gland or organ. So that Dr. Goodhart figured that out back in the 60s and kind of plotted it out through using acupuncture meridians and that sort of stuff. So when we find that weakness, there's referred pain areas all over as well. Like, the heart refers down the left arm and that sort of stuff. So we use those pain areas. We use the weak muscles to then identify as a structural need, a nutritional deficiency, and a toxin that they're exposed to, or an emotional need. And then we apply that therapy. If it shows up as a food or as a nutrient need, applying that, exposing, if you will, the patient to that product will create an immediate strengthening and immediate reduction of the tenderness, so that, again, they leave the office knowing that, wow, I need this zinc, it's going to help my stomach, it's going to help my hormones and my immune system, that stuff. So I want to demonstrate to them during the visit exactly how that's going to benefit them, so that then they're inspired, to better compliance.
You're talking about solutions that you can get them for $5-6 or so, and you get them on Amazon. You get them in an hour.
Right.
Right.
Easy solutions, right? And we can even use that same protocol to identify what supplement or what form of zinc, for example, is going to be the best one. Do we need a zinc that's blended with other minerals, or do we need something that's very strong and chelated to animal product, or that sort of stuff.
Recommend a certain brand of vitamin then too?
There's several that I use. I do, full disclosure, I do teach for standard process. So, run around sharing for them a lot. I am working on it.
They've been high quality for the last, 30 years?
they started in the 30s. So
Forever.
yeah,
Forever.
yeah. And I am working on a supplement line to go specifically with the headaches. So soon, when people go on headacheadvantage.com, they'll be able to click on right side of headache, and we'll have a product line specifically for the right side of headaches, or for the left side of headaches.
Perfect. Perfect. And also you mentioned tension and the headache, tension headaches also in the back.
Right. So super common, right?
Yep.
Thyroid medication is the most popular, outsells cholesterol medication even. And once you know, low thyroid is one of the triggers of high cholesterol. So, so we want to look at why the thyroid's not functioning. Again, one of the things thyroid does to regulate metabolism is activate proteolytic enzymes, or enzymes to help break down protein. And so when that mechanism is compromised, it causes a weakness of the neck extensors on both sides of the neck. And so that's what sets up that weakness and the tension in the back of the head. So we want to help the thyroid function better naturally, not necessarily with pharmaceutically. I mean, as long as we're talking openly.
Yep.
There's I teach a 12-hour thyroid seminar, and I kept coming across this paper. Everybody was quoting this 200% increase in breast cancer with thyroid people that were on thyroid medication. It's like, well, that's pretty radical stat. We need to figure this out. And so I was able to extrapolate out to the fact that the thyroid medications inhibit methylation. Methylation activates tumor suppressor genes. So if methylation is under functioning, then we have reduced mechanism of suppressing tumor cells. And so we've got this radically increased preponderance of cancers with those thyroid medications. And so we want to get the thyroid functioning properly, or at least if they're married to that medication, at least offset with the proper folate supplement or things like that to offset the negative consequences of continuing with that medication. So that's kind of the big risk when it shows up as a tension, headache, thyroid, hypothyroid problem. It's like, we need to correct this. And I mean, I had a gal that didn't end well, unfortunately. This gal, when I first started figuring this out, she was on thyroid medication. It was the reason she had, tumor markers were, 100x of what they should have been. They were in the thousands and should have been in the 20s. I'm like, it's your thyroid medication. We need to do this. Got her off the thyroid medication, put her on some supplements, had tyrosine and B1 and methionine, things to help the thyroid function better. Her cancer tumor markers went down to less than half of normal.
Wow.
and she was doing great. About 3 months into the protocol, she had massive stress in her life. Her energy tanked a little bit. She panicked. I need my medication, went back on her thyroid medication. And within a month, her numbers were back into the 3000s, and unfortunately, this gal had the most gnarly stress cycle. I mean, we talked, the story was sad and drawn out, but I mean, that stress, and ultimately it cost her life. It was kind of not the way we wanted to end, but it was such a profound, X equals Y, for her. And I've seen it hundreds of times since then. So
it's almost like, how do we get, I mean, being a chiropractor also, or any healthcare practitioner, how do we get people to understand your medication isn't working, or the risk is worse than the benefit? How do you explain that to patients where they still make the choice?
Right. So demonstrate, hey, this is the consequences. Notice you're more tender here with this medication. In general, energy goes in the right and exits the left. So if I put their thyroid, I mean, this is out there sounding, but I mean, the reality is it works. If I put their medication in the right hand, areas that are going to get worse from the thyroid, those muscles are going to get more tender, more compromised. They'll get weak. And so they physically, tangibly feel it, tactfully feel it. And then we put it in the left hand. It's like, hey, if you cut this medication out, this is how much better your liver is going to function, your thyroid's going to function, that sort of stuff. So, and I try to work it out as best I can to, like, hey, if you stay on the medication, here's the supplements you need to take to offset to minimum for damage control.
Give them a plan, right? If you want a plan C versus going off completely. Oh, got it. Okay.
Right. So yes, here's damage control. Here's your best case scenario. It's kind of how I would try to handle it.
That's fantastic. And then we're going to also say versus medication use or other things too. Also stress levels and emotional, psychological stress. How does that affect, and how do you reduce someone's headache symptom by talking to them or figuring it out with them?
Right. So the frontal headaches typically is a high cortisol response,
Okay.
ultimately inhibiting stomach acid. So initially, when cortisol goes up, serotonin goes up to help
Okay.
us focus on the solution to the stress. But with that noradrenaline, that's part of that whole focus mechanism. But when we're in that chronic stress cycle, ultimately norepinephrine ends up low, and norepinephrine turns out is gastroprotective, so it protects the stomach lining. So if we're in that chronic stress cycle, ultimately norepinephrine ends up low, and that's the kind of the mechanism for a stomach for ulcers. So we lose the brain's control or protecting of the stomach, if you will. So we want to balance that stress response. My favorite supplement in that regard is ashwagandha. Is a
Got it.
kind of it's all over the press right now, is because everybody's stressed out of their heads, right? So ashwagandha is a nice way to kind of blunt that overzealous stress response. There's Lyme is a big kind of buzzword these days. The common thread that I have found with all the different Lyme pathogens is that they inhibit the sulfation pathway in the liver. That sulfation pathway in the liver is where serotonin gets broken down, is where cortisol gets broken down. So if we're not breaking that down properly, then we're in that chronic, overwhelmed, stressed and obsessed sort of pattern. So in that case, we want to try to treat the parasite or the spirochete or the virus that is associated with Lyme, for example. Myrrh is kind of a fun supplement, just like they gave Jesus. It's a great herb to help fight bacteria or fight Lyme. So that's another way if they're having trouble falling asleep and they've got this chronic stress cycle, something like myrrh could be a good.
How would you test if they have Lyme disease? How would you do that test? I'm curious.
Yeah, I have test kits for it for the
Okay.
75
Got it.
different or
Okay.
76 different pathogens. Typically, when they show up as a low sulfation, high serotonin,
Okay.
I'm going right after Lyme, because that's a pretty typical pattern. Most people We'll just tell the story, right? Years ago, this gal came in. I'm a big bike rider. I was on my way up a hill, riding up a hill, and I heard the guy behind me saying, "Yeah, my wife's been diagnosed chemically imbalanced." It's like, well, what guy wants to confess that about their wives, right?
Yeah.
So I'm like, so we get to the top of the hill. I'm like, all right, I pounced. I'm like, tell me about this. What's going on? And I'm like, for sure, let's get her in. I started treating her. Somebody else diagnosed her. She started getting better. I treated her 2 or 3 times. Anxiety was down noticeably. Somebody else diagnosed her with Lyme. She did her internet search, ended up going to this clinic in Florida, staying there for 2 months to try and treat the thing. Came back virtually no better. And incidentally, she was the kind of the executor. She was very active in the 2 local support groups for Lyme. And so she came back again. I treated her a few times. She was doing great and got her doing well. And of course, she goes back to her support groups and everybody wants to know what she's doing because she's actually better, right? So that kind of made me the local Lyme expert, and figuring that out. And again, my unique offering in that arena is that sulfation pathway, that key pathway in the liver. That's how they become stealth pathogens. That's how those bugs prevent the immune system from recognizing them, is by inhibiting that sulfation pathway, so that then they can continue to proliferate without being identified.
It almost you're helping people find a different path than just normal medicine. Do you teach this to other chiropractors or healthcare practitioners, or do you focus on more of the book and more private practice?
Both, yes. I've That's the poster behind me is the reflex points and things for doctors predominantly. So that's helping other docs figure it out. Teach around mostly through standard process, but I do have some training videos and things for doctors as well.
That's awesome. And talk about your book. Why did you write a book?
Because I had headaches, and I did the lit search, and nobody else was talking about headaches this way. Nobody else had figured out the patterns. Most of it's based on acupuncture. I thought for sure some of the acupuncturists would have capitalized on it already. The information wasn't out there, and my favorite line is a headache never leaves my office. So, I mean, that, with that, it kind of gives that bolstered confidence, like, this is the answer. We need to get this information out there. So, I started out trying to do the whole body. I'm like, I gotta, help people understand, how to learn from their pain
Yeah,
and to,
yeah.
get better. And it's like, I'd never be done because I'm learning every day, and, it'd never be finished. Then I realized I got into healthcare for headaches. And the reason it's called the headache advantage is
Okay.
because, for me, clinically, the location of the head pain really tells the priority for what that person needs. So they might have hormonal problems and digestive problems, and this whole, list of things that they lay out for me in the consult. The location of their headache is where I'm going to start, where I'm going to pounce, if you will, treatment wise, because they could have 15 different symptoms. If they have a left-sided headache, I know low stomach gas is the priority for that person. And so that's where it becomes an advantage, or again, helps us prioritize what a person mostly needs.
And walk me through your book too. How's your book outlined?
Yeah, so the first few chapters are general health things, chill out on sugar, artificial sweeteners are going to kill brain cells. We kind of go over some of the typical stuff like that, dehydration. So I kind of lay out some general health principles. And then we go into the 7 patterns and describe some of the, there's a symptom list, checklist, if you will, associated with the gallbladder and with the stomach and with the thyroid. So it goes through to help people understand, okay, this is where I need to target my energies, if you will. And then there's the head program is kind of the healing, where we lay out, there's flow charts in there. So if you have a left-sided headache, and it says left-sided headache and stomach, and then it's got kind of 4 columns of symptoms associated with the stomach. So a person can try to identify, what aspect of their stomach to target their care, their lifestyle choices.
You're almost like you're giving someone the visual, there's different ways to actually understand where the headaches are coming from and even how to treat themselves, correct?
For sure. Yeah, it's all about empowering people.
Well, the problem is you can put yourself out of business, doc. That's the problem. You're gonna
Great.
isn't that the best though, when you help someone out, you just want them to get better, boom, someone else walks through the door, boom, someone else has a question. He's like,
right.
You're constantly busy.
Right. I mean, clinically, that's what I teach when I teach docs. I'm like, that's how I can tell when I'm out of it, is when I'm on, every patient is referring by the second visit. If I'm distracted and worried about some other, unrelated stuff, then
business or some paying taxes or something.
Right. So got to keep that out of there.
What's your favorite day of the week?
Oh, yeah, that's a little out of me. Saturdays, I guess, just because I get to go ride my bike extra long.
How about patient? What's your favorite patient day of the week?
I treat 40 hours a week still. So, I love every day. Every day I walk in, there's some new case, and every couple minutes there's a whole new set of new person in front of me.
That's like the passionate chiropractor when they want to say, what's the next problem I can fix? Who else has the issue where, okay, I could use my information, and boom, it almost excites you sometimes more than the patient.
Right.
It's the best.
Yeah. One of the last patients I just saw, I'm like, she had, again, same long list of symptoms. I'm like, but I'm like, this is the key factor. When you've got 8 different things, these are all big name conditions, big name things, but we got this one central theme. I'm like, this excites me. We're going to nail this. This is a game changer for you, and this is like, feet aren't touching the ground,
You start seeing their information, you're like, even before they're done, they're like, I already got it. I don't want to say anything. You let them read the whole thing off. I already know what's going on. I'll let them kind of do their own thing at that point. And then I'll go, okay, now let's figure out exactly what's going on. So you take it almost at their pace, even though you've already solved everything.
Right. Just confirming suspicions by that point.
Do you work in solo practice? Do you work with, like a lot of staff, or what do you like to do?
Yeah, I've got 3 other docs that work with me, and the support team goes along with it. Yeah.
That's fantastic. Do you have more of just for clinic wise, more of a multidisciplinary practice, or just all focused on headaches?
It's multidiscipline as far as everything and anything. People, whatever people have. So, but we're all muscle testers doing applied kinesiology. Most of the docs that work for me came to me as interns, through school, and we kind of trained them up we got them while they were young and raw.
That's part. I have one right now, Lauren. She's looking to finish chiropractic in about 2 years or so, and she'll be next up. She's next up in my office.
Awesome. Yeah, pay it forward.
And then how is your consultation? Is it one-on-one? Do you have another doc in there, staff in there too, or what do you like to do?
I do one-on-one all the way through, unless somebody's in their training. I do allow interns or docs to shadow, so patients are used to that, but they're pretty much just there taking notes if they're in it.
I love interns. Why do you like interns in your office?
Pay it forward. We need more people like
Mhm.
us out there doing it, making a difference. You know, like you're kind of alluding to, the passion is contagious.
Huge,
So I mean, we
huge.
got to keep it going, right?
Yeah, and you felt you have a way for people to get better, increase their not only longevity in life, but also decrease mortality. Why wouldn't you want to share it with the world?
Yeah, right. How could you retire from that, right?
No, no,
But
no.
yeah.
And then also, how long has your book been out for?
2 weeks. It's fresh.
Wow.
Yeah,
Well,
yeah.
that's why I waited for the show for. I'm like, why is it taking so long for the show? I'm like, gosh, let the book out first.
Yeah.
And then your book's on Amazon, correct? Also on your website too?
Yes. Yep.
Perfect. Good. And I'm going to say, get the book. It's not going to be $1,000, but just
Right.
understand for your own knowledge, if you have headaches, to make sure, okay, am I doing the right things? Can I do something different? Can I make a visit to Dr. Vrzal and just me see if I'm doing the right things before I go down this pathway of now causing more risk factors for tumors, for, if you want to call it, metal toxification of my body that I may be
Mhm.
missing because I'm not going the natural route versus medical route is, here's your pill, try this. Here's this, try this. Doesn't work, we'll try something else.
Right.
That's all
Yeah.
it comes down to.
It's trying to empower people to learn from what their body's telling them. Take
That's
advantage of
awesome.
their pains.
Yes. And then on
Mhm.
on the copyright, the notes for one too on this Facebook Live, along with we're gonna put it on YouTube also and other places as podcast. We'll have his website on there, Facebook page, Instagram, LinkedIn, and also his website and YouTube, and also the actually more importantly the link to the buying the book on Amazon. So get the book,
Right.
but also go to his Facebook. I like his Facebook, Instagram, and even YouTube too. Has ways to listen more and more how you can help yourself get your headaches better and just your overall lifestyle better. Correct?
Yeah, absolutely. That's what I'm all about.
Perfect. Hold the book up, Doc. Take a quick picture of the book for one. There we go. That's going to find that right on. Right there you go. Right on, and smile to smile also. At that point, get the book. I'm going to get the book actually myself. At that point, figure
Awesome.
out what else can do in my practice to learn more, help my patients get better, and like you said, at that point, it's paying it forward.
Yeah, and if you want to keep it in the practice, let me know. We'll try to figure out a way to get you some bulk pricing or something as well.
No worries. I want to check it out. I always like to get the book first. I've done that with other chiropractors on the
Sure.
show or other people have information out there, so I can leave an authentic review and understand exactly what you've taught
I
other
appreciate
doctors
that.
and patients in general. So I appreciate you having this book and helping the world get better. So thank you for the show. I'm gonna hold off for 1 second. I'll say goodbye to our audience for one, two, the Crooked Spine Show, and stay there for 1 second, Doc. Thanks,
Thanks,
guys.
Dr.
Thanks so
Tony.
much.
Appreciate it.
Of course.